Correct.
100%.
No need to suffer in silence. There are answers, and you and your care provider team can absolutely find the right answer for you if you're dealing with moderate to severe hot flashes.
Good.
If you are suffering moderate to severe hot flashes, especially if a hormone option is not right for you, make sure that you seek care and know that there are non-hormone options for you that are FDA approved.
Yes, and don't stop until you reach the right answer for you, because you're worth it.
Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a wonderful day. Great news. A new hormone-free treatment is now available for moderate to severe hot flashes due to menopause. Hot flashes are a common symptom of menopause and one of the main reasons women seek treatment. Hot flashes may impact women differently, and some can be disruptive. Individual hot flashes can range from mild to severe, last anywhere from 1 to 5 minutes, and may occur a few times a week or several times per day or night. Wendy Lee Curtis, one of our guests, was experiencing moderate to severe hot flashes due to menopause and was unprepared for the impact that they had. Her openness and determination to share her story aim to foster greater awareness and empathy, encouraging women to embrace this transition with knowledge and support. Dr. Diana Bitner, our other guest, and Wendy Lee Curtis are partnering with Bayer to discuss Lancuit, 60 milligram capsules, a new FDA-approved treatment option for moderate to severe hot flashes due to menopause. Dr. Diana Bitner, MD, is a board-certified OBGYN, certified Menopause Society Practitioner, and leading expert in midlife and menopause care. Wendy Lee Curtis is a dynamic and multifaceted individual whose journey through menopause has been both transformative and challenging. A former Broadway performer and TV news anchor at KNTV ABC in Las Vegas, Wendy now channels her creativity and leadership skills as a facilitator at Cornell University. Before we get to our guests, a reminder and a request. Please, if you like our show, give us a 5-star review or a thumbs up on Apple, Spotify, or YouTube, or wherever you're listening to us. It really helps us get the word out to more people. Thanks in advance. So welcome to the show, Dr. Diana Bitner and Wendy Lee Curtis. How are you each today?
Great. Thank you so much. We're grateful to Bayer that we can be out here talking about menopause.
Absolutely. Thank you so much for having us. We appreciate it.
Good. My pleasure. So, doctor, what is Lancuit and what did the clinical trials show about it?
Sure. Lancuit is a new, recently FDA-approved prescription therapy indicated for the treatment of moderate to severe hot flashes and night sweats due to menopause. So it's exciting that this is backed up by clinical trials that show the safety and efficacy of Lancuit.
Good. Now, is this hormone replacement therapy or is it different?
It's treatment for menopause symptoms, but it's non-hormonal. So thank you for clarifying that. It is non-hormonal, and so it's a new option that women have who wouldn't otherwise qualify or wish to take hormones.
Great. And doctor, let me ask you one more question, and then we'll get to our other guest here. Can you tell us what's the difference between moderate and severe hot flashes? How would a woman know which one she's having and when she should do something about it?
Sure. Well, first of all, I would argue that for a woman having any of these symptoms that are disruptive, definitely time to do something. But that moderate hot flash or night sweat is associated with some distraction, but not really a lot of sweating. And that severe hot flash can feel like a volcano to some, where it starts as a warmth in the chest and it rolls through their body. And some women talk about a top blowing off or a hot spot on their head, but it definitely causes significant disruption to their daytime and or their sleep or their nighttime.
Mm-hmm. Got it. And Wendy Lee, what was your experience with moderate or severe hot flashes due to menopause?
You know, every woman has a different experience with hot flashes. For me personally, my experience was in the moderate to severe range with sudden onset. So my hot flashes would come up anytime, any place. And when they were severe, there was a major impact that I was experiencing, whether that was at home at night, trying to sleep, just, drenched in night sweats, or at work, doing the kind of work that I do now as a TV broadcaster, where you would just see visible sweat pouring down my face or even hanging out with friends. It's pretty distracting.
Yeah. So what would you tell someone who's experiencing these kinds of symptoms? What would you tell them to do? What's your recommendation?
The one thing that I would say is to be absolutely relentless and unapologetic and seeking support and care for hot flashes during your menopause journey. Don't be afraid to describe what you're experiencing and discuss it with your healthcare provider so that you guys can have those discussions about options. You can't fix what you won't admit is broken.
Yes.
So I would just say, just keep going and just know it may take a little time to figure out exactly what works for you. So don't be discouraged. Stay committed to getting this resolved for yourself. Keep talking about it so that you can actually get that relief.
Good. So you're really talking about advocating for yourself.
All day, all day.
And sometimes it takes several healthcare providers to get to the answer. So for women to not give up, to keep asking and talking to someone who knows all the options, including the new non-hormone prescription therapy, Lancuit.
Yeah, doctor, I was going to ask exactly that question. I mean, how familiar are practitioners with menopause or the symptoms of menopause? When should a woman consider seeing either a specialist or somebody else? How do we make that decision?
Yeah, I first of all would advocate for a woman to ask the level of training of the provider they see. Certainly if they've attended a Menopause Society meeting or they're certified in menopause, that would be the best. But are they well versed? Can they offer many options? And to just make sure that they advocate. Some patients come in with lists or, hey, I Googled this and they feel bad. I'm like, no, bring it on. All the information, the better. So more and more healthcare providers are becoming versed because so many women are empowered to ask. So it's all a good thing.
Good. And I was going to ask both of you, what's your impression of women's comfort in bringing this up to a doctor? They're just starting menopause or just starting to feel these things. Is there discomfort or reticence in terms of bringing this up with a doctor?
I think it's like grief, right? First you're in denial, like, is that what I think it is? And then you're just in the, okay, well, this is just par for the course. I can wait this out. It's not that bad. And until it is. And then once and if you reach that stage, even knowing where to go, right? How to find the right advocate for yourself, because it may not be a healthcare provider that you're already partnered with, right? You may actually have to step outside of that existing relationship to get that specialty care around hot flash and menopause treatment. So the embarrassment, the denial, I think those are the two big ones. And if we can get past that, then we're on our way to feeling like ourselves again.
Yeah, There's been about 30 years where menopause just wasn't discussed in this country and women were taught to buck it up, and we're getting a lot better.
Yeah,
work to do though.
So let me tell people where they can go to learn more. It's Lancuit.com, and let me spell that. It's Lynkuet, Lynkuet, Lancuit.com. And it's non-hormonal treatment for moderate to severe menopause symptoms, correct?
Correct. You nailed it. And I just encourage all women to talk to their healthcare provider and learn more. And they can read even the prescribing information about the safety features at Lancuit.com. Yeah,
and let me ask you about that before we leave. Talk to me about the safety. What has been shown? Are there side effects? Is it safe? Just to reassure people.
Of course, it's very important we talk about this. So we know that there are effects from the Oasis clinical trials that show effect on the nervous system, such as women who have a history of seizure, they might be more likely to have a seizure. The most common side effects are headache and fatigue and daytime sleepiness. And it can also affect lab liver values. So it's also important to note that, of course, women who are pregnant should not take Lancuit. So those are, again, important facts that women can read about more on the prescribing information at Lancuit.com.
Good. But I would think the important thing is not to be scared of this. The important thing is to talk about this with your doctor and see if it's appropriate.
Correct.
100%.
No need to suffer in silence. There are answers, and you and your care provider team can absolutely find the right answer for you if you're dealing with moderate to severe hot flashes.
Good. Any questions I didn't ask that I should have, or what kind of message would you like to leave with people today?
just to make sure that women advocate for themselves. And if you are suffering moderate to severe hot flashes, especially if a hormone option is not right for you, make sure that you seek care and know that there are non-hormone options for you that are FDA approved.
Yes, and don't stop until you reach the right answer for you, because you're worth it.
And doctor, let me just ask one more thing. Is this a patch? Is this an injection? Is it a pill? How do we take it?
Great question. It's a 60 milligram pill that you take 2 a day is the usual dose. And so it's a prescription therapy that can be prescribed by a healthcare provider. And again, it's FDA approved non-hormone therapy.
Good.
So good question.
Great. Thanks so much for being with us both today. We've been talking with Dr. Diana Bitner, MD. She's a board certified OBGYN, certified Menopause Society Practitioner, and leading expert in midlife and menopause care. She serves as assistant professor at Michigan State University College of Human Medicine and is co-founder and chief medical officer of True Women's Health. We've also been talking with Wendy Lee Curtis. She's a dynamic, as you can see, dynamic and multifaceted individual whose journey through menopause has been both transformative and challenging. A former Broadway performer and TV news anchor at KNTV ABC in Las Vegas, which is where I am, Wendy now channels her creativity and leadership skills as a facilitator at Cornell University, teaching a course on executive presence to MBA candidates. Thanks both for being with us today. It's been great to have you.
Thank you.
Thank you so much. And hello to Las Vegas.
Yay, Las Vegas. Yes, great. Good. Good. All right. So this has been Jonathan Marx. It's been wonderful to have you here. And as we say at the end of every show, go to health. God bless. We'll see you again next time. Take care. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.